Hi, my name is Leslie, dental hygiene student at Plaza College. Today I'll teach you how to use the Explorer, the 1112, a universal assessment instrument for tactile detection of calculus and surface irregularities. You'll learn the parts, indications, the grasp and fulcrum, the working end, selection for anterior and posterior teeth, the instrumentation sequence, tactile cues, and contraindications. Then you'll see a complete demonstration. So this is the tip of the Explorer, this is the terminal shank, and this is the handle. And the seam is on the other end. We have the tip, the terminal end, which is a little blurry, and the handle. And that is the Explorer we'll be using in today's video. Indications and contraindications. Use the 1112 to detect subgingival and supragingival calculus, margins, and CEJ. So typical tactile findings are like spicules, which can describe them as gritty, like a little click when you're using the Explorer at the line angles or the interproximals. A ledge or a ring is like a speed bump parallel to the gingival margin. Things we also feel with the Explorer are the veneers. It's like a thin drag on the cementum. Nodules, a larger or crusty mass. Contraindications: do not use heavy pressure. Avoid forceful, like sticking in suspected carious lesions. Our goal is to be gentle, is to assess no cavitation. So now we'll be going over the grasp fulcrum ergonomics. Use a modified pen grasp when using the Explorer. The thumb and your index finger are going to be positioned in a relaxed C-shaped form. Middle finger is on the shank to feel vibration when you're using your Explorer. The ring finger is going to fulcrum, so we're going to pretend we're fulcrumming. I'll show you later on how to do it on the typodont to stabilize your fulcrum on the tooth surface. The fulcrum is useful for control when you need to use the Explorer. So here's a close-up demonstration of rolling the handle between the thumb and the index to keep the tip adapted. So I'm going to do it outside of the typodont to see so you can see how the rolling works. So we're going to roll, right, while still maintaining a steady fulcrum. And then I'll show you how we do it on the typodont or the patient. Now I will be showing the working end selection. We're first going to start off with the posterior teeth. I'm going to show the V and the parallel Q. So for this, we're going to use a mirror and our Explorer. So we're going to insert the mirror, going to retract, and we're going to see the tip of the distal interproximal of the most posterior teeth, but for this video purpose, I will be using the premolar just for a better visual. So we'll use the correct end. The correct end, the terminal shank, is parallel to the tooth's long axis, and the shank forms a small V. As you can see here, there's a small V that points distally. If the lower shank isn't parallel or the functional shank wraps the wrong way, so I'll show you this way, this wraps around the tooth. This means that you have the wrong working end. right? So if that happens, when you stand the instrument up, you're just going to flip your instrument over. And this is what you should see when you have the right working end. The right working end, the instrument is parallel to the long axis, and there's a V, as you can see here, that points distally. If it points the other way, it means that we have the wrong working end. Now that we have identified the right working end versus the wrong working end, we're gonna do the posterior stroke sequence. So the posterior stroke sequence is from distal to mesial. So we're gonna come in and verify that we have the right working end, which we do, right? Remember to maintain a good fulcrum. So we're gonna start at the distal line angle. The distal line angle will be right about here where I'm pointing. We're gonna, with the tip pointing distally, right? So we're gonna go in, right? Use short overlapping walking strokes to fully reach the distal interproximal. So we're gonna do that. Once we reach the interproximal, we stop, come out. Now we're going to do the same coming back mesially. Insert the instrument. The instrument never comes out. So when you're walking, you're making sure you're rotating the instrument as you're coming mesially. So walking strokes, 1 to 2 millimeter walking strokes. We're rotating the instrument until we come all the way interproximal and exit. And now we're going to move to the anterior stroke sequence. So the anterior stroke sequence is from the midline, so the midline is the middle of the tooth, to the interproximal in both directions. So right now we're going to be doing the toward surfaces. So toward surfaces is you're gonna find the midline, and it's work towards you. So towards you is that's closest to you, right? And the away, you do the midline and away. For anteriors, the correct working end hugs the surface you're on. So, as you can see here, this hugs the surface we're on. If it were the wrong working end, we're going to flip the instrument over just for demonstration, educational purposes. This does not hug the tooth. The tip, if you can't see in the video, it kind of flips away from the tooth, and if you insert it into the gingiva, this will hurt the patient. It will lacerate their gums. So you want to be careful when you're finding your right working end that the tip does not flare towards you, but rather towards the tooth or hugs the tooth that you're working on. So I'll show you again. This hugs the tooth right here. And another way I've also learned is like Pac-Man. So Pac-Man is eating in the direction it's going, right? So Pac-Man, we can see like the Pac-Man little figure here, and it eats the way it's going, right? So that's another way we can determine the right working end for anterior. And when we're doing the away surfaces, we start on the canine that is closest to you. So in this case, it would be this one right here. This is our canine, and we're going to start from the midline, the middle of the tooth, distal, midline, distal, midline, distal, all the way to the other canine. So this here hugs the tooth. So we're going to start midline, insert. Remember to rotate at the line angle and go all the way into proximal. And you're going to come out. I'm going to do the same. Midline. As you're walking, you're rotating at the line angle. You're going to go all the way into proximal and come out. And you're going to do the same across from canine to canine. So we're going to come in and do 1 to 2 teeth lingually so you can see how it is done. So using your mirror, you're going to use indirect vision. Remember the instrument, the explorer should hug the tooth. That way you know it's the right working end, right? And we also can see so from the midline, go ahead and insert the instrument. Gonna come in all the way into proximal and come out, right? Safety and common errors. Common errors. Pressing too hard. So pressing too hard, you'll lose its sensitivity. Not keeping the terminal shank is another common error. Not keeping the terminal shank parallel in the posterior into proximals. And that is the Explorer 1112. Thanks for watching.